What if you did not have to depend on addictive medication, take painful injections, or undergo risky surgery to get rid of your back pain for good? I'm Dr. Frank Garza, and in the last 12 years, I've helped thousands of people just like you overcome their back pain. And in this video, you're going to learn three things. First, the three common causes of back pain. Second, you're going to learn how to identify that cause of your pain. And lastly, we're going to reveal the single number one biggest mistake that back pain sufferers make that keeps them from unlocking their true healing potential. Now, this is crucial and essential in gaining control of your life again and getting back to normal. This clip is from a live previous workshop where my wife and I, who is also a doctor of physical therapist, broke down all the characteristics of the three common causes of back pain. Now, two of them are really common. One of them is really tricky to identify. So pay close attention as you watch the following clip.
All right. So welcome, everyone. I want to first thank everybody for coming. I want to tell you a little bit about ourselves, our company, how we got to where we're at, a little bit about what we do. I guess we just got some other people walk in, but my name is Frank Garza. This is my lovely wife, Amy Garza. We're both doctors of physical therapy. This is Austin Brown, and we have Richard Chambers. He's a student physical therapist, and Austin is also a doctor of physical therapy who just recently graduated. We all graduated from the University of St. Augustine. That's where I met my lovely wife. We graduated from the Florida branch, and Austin and Richard are currently going to school in the Austin campus. Like mentioned before, we all have our doctorates or working towards our doctorate in physical therapy. And this specific curriculum has a high emphasis on spine and back treatments. Okay, so we're a lot of our treatments entail a lot of manual therapy, which we have found that patients really get a lot of benefit from, whether it's massage, manual stretching, manual techniques that we do to the pelvis and the back, the neck, the shoulders, really all joints in the body. We have found that our patients really benefit from that, and we've seen a lot of results from it. So that's one of the reasons why we're here, is to share some of those stories with you and some of the things we do to better help you. We opened our outpatient practice in 2011. This is our second location. So we were first located down the street on South 10th. We've recently got a bigger space, so we are growing. We're seeing more patients, and we're really excited about that. And we're getting more and more success stories, and really just makes us feel good about what we're doing, and just confirms, why we got into this field, and really that's to help people out, and makes us feel good about that. So we have twins. They're going to be 3 years old in January. Their name is, I have a boy and a girl, Contessa Marie Garza and Francisco Garza IV. They are a joy to be around. They just don't stop going, and they keep us on our toes every day. So, like mentioned before, in the past 4 years, we've successfully treated hundreds of people suffering with back pain and sciatica, and we have a combined experience of almost 10 years. Amy, 10 years. I am going on 10 years. There's also, if you haven't been to our webpage, there's also a video that we did on back pain and sciatica. It's out on YouTube as well, but it's on our webpage. If you feel that you don't get all the information, or if you want to share that with somebody, you can always direct them in that direction to visit our webpage, and you'll find that video there. So that's a little bit about ourselves and our company and what we do. Would you like to do a demonstration on Pat? I mean, she raised her hand. I don't want to let her wait. I know we probably.
She can wait. I saw what he could do. I can't do any of those things.
Okay.
I don't want to sit down because I'm embarrassed.
No, so let's first kind of give me a history of what's going on. You said you had bilateral.
Okay, so this knee has got screws in it from an accident.
Okay.
And this one has been replaced about 15 years ago.
Okay. And then the back pain's been going on.
But I just attributed to the girls.
Okay, so you think maybe postural. Okay.
Yeah, I thought, because I'm big there. And then I had the sciatica that developed.
Okay.
And
how long has that been?
It came on September the 22nd, and
Okay.
my pain level was at about a 12. They gave me, well, we're in Canada, it's a little different than what it is there. And where I live is way, way, way up north. It's like
Okay.
a clinic. So
Okay.
they gave me something for pain, and that didn't work. And then they, Lord, what did they give me?
Okay.
I was morphine.
Okay, so you're in a lot of pain.
Yeah.
Okay.
And morphine always affects my brain.
Okay. Is there one specific thing that bothers you? Like standing up from a same position, rolling in bed, standing, anything in particular?
Standing for any period of time.
Right.
Or this morning I wanted to get a whole lot of little things done.
Okay.
And it was like, I had to be on the couch for
To take a break and then
like 20 minutes before I could get dressed to get here.
get moving. Okay.
Like,
Let's do one. Yes, you gave me a lot of information. I appreciate. So I'd like you to start, we'll face the wall, and you're going to do that bending over for me. And then stop if you have pain, okay? Okay. Come up. Did you have pain when you grabbed the table?
No.
Oh, were you just doing it for balance?
I have bad balance.
Okay,
So
okay.
Let's just start again.
Okay,
I
okay.
know how far I got, and then
Okay.
I get that far, and then it's down
Okay.
there.
So down the right side right here, okay?
Everything for me is mostly on my right.
So that increased your pain,
Yes.
correct? Okay. All right. So let's do side to side motion. Yes. How's that feel?
Take the fun.
Okay. And the other side?
Um,
Does that increase
Yeah.
it? Increasing it.
increase the pain.
Okay. Hands on your low back, and I want you to go backwards as much as you can. Okay.
This is a piece of cake.
So that feels better.
Yeah.
Okay. Okay. And stand up. I want you to pull up with this knee and down with this knee. At the same time, though. No, you're going to push into my stomach with this one. And you're going to pull up towards your head with this one. Okay, ready? Go. And hold it. Breathe. 5, 4, 3, 2. Relax. Push down with this one. We're just going to switch. Down, and then you'll go up with this one, okay? Wait, not yet, not yet.
Oh,
Don't.
you're not ready.
I'm not ready. Okay. Okay, ready? Go. 2. Relax. Good. These next two aren't as hard, and then we'll be done. So you're going to take your knees and push out into my hands, okay? So first, relax your feet, got them. Okay, push. Hold it, breathe. 5, 4, 3, 2, relax. And then squeeze them. Push. Relax. Good. Again. Push, 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 push. Relax. Go ahead. We'll just see how it feels. Do the forward bend again to see if it feels any better. Come up when you need to.
Yeah, I think I'm down further.
Okay. Okay. And come up.
Pat, did you get some relief with some of those motions? Good. Had you had any of that done to you before? Okay. All right, so moving on. So now that we've actually treated or helped a couple of you out with some of what we do for physical therapy, we're going to talk about in depth as to what are the common causes of back pain and sciatica. What do they feel like? That way you can relate to them. And, you know, like mentioned before, being in this kind of pain can be very, I don't want to say embarrassing, but it can put a burden on you because it can be so bad. It can't let you play with your grandkids at home. You can't bend over to pick up a bag of groceries at the grocery store, or supper. You know, can't cook supper. You know, if you're that person that has to lean forward on the shopping cart to go shopping, it feels like, oh, that's so embarrassing for me to have to do that. You know, we're here to tell you why it is that you feel that way, but most importantly, you know, a solution for that problem. So what is sciatica? Sciatica is pain as a result of tension on a nerve that runs from your low back all the way down into the back of the leg or the thigh into the foot. Pain running down the back of the leg can be caused by the problem in the back or the pelvis, okay? Sciatica sufferers may experience pain, tingling, or numbness, and a lot of that can be in this region here, into this region here. Or sometimes when it's really bad and severe, it could cause people to have what they call drop foot, and that's where your foot doesn't function. So you can't do this with your foot because the problem is so bad that now you're walking and and you're dragging your foot and you can fall. So that's one of the most severe cases, okay? And that can be reversed depending on what the cause is and the proper treatment. So that's kind of what people would feel. Now, as therapists, you come in and you have that on your diagnosis, but it's our job to say, okay, what's causing that sciatica? Where is it coming from? Because that's what we want to treat so that you can get better. Okay, so the 3 common causes are like listed there: herniated disc, stenosis, arthritis, degenerative disc disease, and then the third one, an SI joint pelvic dysfunction. Okay, so we'll get into the herniated disc. So what does this feel like? So Juan, you said you had a herniated disc problem. Now, came out. You say you had that because it came out on your MRI. Okay. Do you have any pain, tingling, or numbness down your leg? Not yet. Okay. Pain is mostly in your low back? Okay. So the herniated disc may or may not be contributed to your low back pain. And we'll get into that in a little bit. But some of those people that definitely do have a herniated disc, most of them will fall into the younger population, and it'll be as a result of trauma or contact sports. They'll have pain with bending forward, okay, and they'll have relief with extension. Is that kind of what you had when you did your range of motion? Okay. And you know you have a herniated disc. Okay. Pain can be extremely painful. Quick story. My dad, last year in the winter, we have a big pecan tree in the backyard. And he's a very active man. He's in his 70s, early 70s, but very healthy and just always stayed active. So I would say he's strong, bending over for about an hour, repetitive bending, picking up pecans, filling up bags, giving them to his children, Felt fine that day. Next day, he couldn't get out of bed. Extreme excruciating pain. I don't know if that's
dove hunting.
Dove hunting? Yeah. Excruciating pain. He said pain down the leg. He said his leg felt all tight, heavy, couldn't move it, couldn't get out of bed. Long story short, we ended up taking him to the ER because he was dehydrated because he just hadn't done anything about it. We'd gone to give him treatment. We were doing different stuff. It wasn't, it was very acute. Okay, so the pain was just, he did some other things that caused him to go into the ER. He was taking some medication, diuretics, and that caused him to get dehydrated. But after that, he came to us for physical therapy, and we treated him, and he got better. Long story short, he's back to normal. He's doing fine. But the point of the story is herniated disc can cause excruciating pain and put you out of commission. Like, it'll keep you in bed for days. It can. So I just want to make sure. So pain, a lot of times when you have herniated disc, you have pain with lifting, coughing, sneezing is very common. And then the most commonly herniated disc area is the L4, L5 segment, which is this segment right here, this last disc. Okay. That's the most commonly herniated disc. And a little bit about, I know some of you have mentioned MRIs and whatnot. MRIs can be shown to have herniated discs on symptomatic, which means people with pain, and asymptomatic patients, people without pain. Okay. And sometimes those herniated discs or bulges are being caused because of another problem, say an SI or pelvic problem, because if it tilts up your spine in a certain way, then the rest of the segments on top of it will also be affected, and you could also get a herniated disc problem. So the point in that is, like, you can take 10 people that are have back pain and have them do an MRI, and 10 people that do not have back pain and do an MRI. The point is, 8 out of those 10 MRIs on both will show herniated discs. Okay? So that's research that's out there in the literature. So very, very important to seek out alternative treatment, conservative treatment with somebody that's, manual therapy certified or is highly trained in the backs to get some conservative treatment before you go into taking injections or surgery. Pain meds is needed at times because there's a lot of pain, but after you initiate a good therapy plan of care, our goal is, okay, are you reducing your meds? And if you are, great. And then we get to a point where you don't take them, awesome. Okay? So that's our goal. So herniated disc, this problem is usually caused by a disc pushing back and compressing that nerve that exits the spine. So there's a picture of that exactly. So the disc there is that white substance. It's herniating and it's pushing and irritating this nerve. These nerves that come out of here in our spine, they control our lower body. So they're responsible for sensation. They're responsible for movement. And when that's affected and irritated, you can have diminished sensation, tingling, numbness, extreme pain, heaviness in the leg, and just have a very hard time doing pretty much anything. Okay. So that's a herniated disc in a nutshell. Can it heal? Yes, it can. Okay. There's a mentor of ours, a colleague of ours that, we've talked about back issues with. His name is Chad Madden, and he actually had a story where he treated somebody with a herniated disc, had proof of an MRI. That was the exact cause of that person's back pain. He treated him for several treatments, had an MRI afterwards, and the MRI showed complete reversal of the disc. Okay, so can it heal? Yes, it can, with proper corrective treatment by the right person. Okay, so there's a little information about herniated disc and how that causes pain or sciatica. And we're going to get into some treatments here at the end on what's the best type of treatment for that. Okay, so the second most common cause is stenosis, arthritis, or degenerative disc disease. This is most common in our older population. This is caused when the areas where the nerves exit out of are narrowed or they become to get closed, and can be caused by arthritis around that area. For instance, here, this is where your nerve comes out of. If this becomes arthritic or inflamed, you can see how that shuts down that space. And if it does that, it can compress it. The same thing can happen here, and it can happen on both sides. It can happen only on one side. It can switch from side to side. These individuals, most common or most likely, will have pain with extension. They cannot do this. This will hurt. Okay. But yet flexion will feel better. Okay. So here's an illustration of why that happens. So these are your vertebrae. When you do this motion going forward, it opens up this space here. So it relieves that pressure. Okay. On extension, the opposite is happening. The space is being closed. So you can see how it can compress that nerve. If it gets compressed, it gets irritated, and you feel those symptoms down your leg. So some of the other things, so this is the same illustration, but like I mentioned, it can happen on one side, it can happen on both sides, or it can go from side to side. So in this illustration, the spine is bending to one side. And if that's happening, the side that you're bending to is being closed or narrowed. Okay. And the opposite side is being expanded or increased tension. This is the problem is at the joint level. So actually where your bones are in the spine. What you could feel if you've had that for a long time is a lot of tightness and just broad band tissue tightness all in your low back, sometimes up your back, sometimes down your leg. Some other things, I just want to go over them in case I forgot. The slide before it. Okay. All right. So second most common cause, I said that. So the disc space is decreased as we age. That happens naturally. So, that's why it's an older population, or mostly an older population. So most of these individuals will have relief with sitting. So standing with herniated disc gave us relief because this motion here is better for us if we have herniated disc. With stenosis, it's the contrary. So sitting will actually give us relief and will be better for us. Mentioned that pain is limited with backward bending. And so these symptoms are more specific. They will say it hurts right here. It's just all the pain is always right here. Whereas a herniated disc, it can change. It can vary. It can shoot down the leg. Pain first thing in the morning. That's a very, very common She
She has every single one of them.
every one of them.
I'm not laughing with her. I'm laughing.
No.
I'm laughing with
But
her.
you know, the good thing about that is that now we know exactly how to identify with it, and then we as therapists know what to do for it. So it's a win in a way because you know.
Big win.
Good. Thank you. So this is a good one too. A lot of the people that have stenosis, they'll complain of cramping at times. They'll be walking and be like, all of a sudden I get cramps in my legs, or restless sleep, heaviness, weakness. And again, it can be one-sided, both sides, or change from side to side. So those are some of the things we may feel if we have stenosis. Okay, so and those are the diagrams there to illustrate that. Were you able to get the diagrams? Okay, cool. All right, so this third one, I want to pass it back over to Amy, my lovely wife here, and she's going to talk a little bit more about SI joint and pelvis dysfunction.
Okay. All right. So we talked a little bit about SI joint when I was treating Pat. The SI joint is located below the lumbar spine. So here's your last lumbar vertebrae. Then you got this triangle, a bone called your sacrum. Where it articulates with your pelvis is the SI joint, sacroiliac joint. So you have one on the right and one on the left. So where this bone, your pelvis, meets the sacrum, there's right in here is your SI joint. Okay. What causes dysfunction in this joint? Either too much movement or too little movement. If it's too much movement, it's from loose ligaments. So what causes loose ligaments? An injury, or in women's cases, usually it's if you've ever given birth, you've had a sprained ligament, and then years later, if you do something that jars aside, you step wrong, or you have a limp, that because the ligaments are loose, that means your joint's not stable, then you're very vulnerable to too much movement causing pain. In men, you may have an injury stepping onto a platform. You did a jarring movement. You put too much pressure on that ligament. You sprained it. Now you have an unstable SI joint on one side or the other. Okay? Leg length discrepancy. You're very vulnerable to having SI problems because you're constantly having an asymmetry of force through this joint. Okay? Now, too little motion, that's also a dysfunction. Usually degenerative joint diseases like arthritis will cause too little motion in there. And that can just come with age or repetitive motion. If you did a lot on your feet when you were younger, you were in sports a lot, you could have degeneration in that joint. Also, if you know of anyone that's had a lumbar fusion, those people typically will have SI joint dysfunctions because there's limited motion in the lumbar spine. So your SI joint tries to compensate for the lack of movement above it. So if you don't have movement in the lumbar spine, your SI joint is going to try to compensate to give you movement. So that can also be a reason. Signs and symptoms. You have pain in the low back, pain in your buttocks, and pain down the leg. So very common, same as sciatica. So it's what is causing this pain? Is it the sciatica or is it your SI joint? So only really a thorough examination can tell you the answer to that. Let's see, what to do for this. In the physical therapy, we assess it. We find what's wrong, and then we do the proper treatment. If it's malaligned, we put it back in place, follow it up with exercise. If it's inflammation, we try to decrease the inflammation and increase stabilization. Let's see, am I missing leg length pregnancy? Softball pitchers, like I said, repetitive motion. Also, you can have pain in all the surrounding musculature. So all the surrounding musculature can start to spasm in response to inflammation and pain at the SI joint region. So even though this is the source of your pain, you could have groin pain. You could have pain, stabbing pain in your buttock. So those are also common signs and symptoms. Posture. So muscle imbalances. If you have a weak abdomen, tight back, people who stand like this a lot, that also is a contributing factor to SI joint problems. So muscle imbalances, weakness, and posture problems. Okay. I think and then this is going to show you the rotation. So remember, it's the pelvis and the sacrum that are articulating together. So if your pelvis is twisted per se, there's a torsion of your pelvis, that will also cause problems. So not only do we manipulate the sacrum, but the pelvis could be also the source that's out of place, not just the sacrum. If your pelvis is rotated on the right forward, which can happen, that could be the source of the problem.
What about sitting at you sit at a desk
Mm-hmm.
all day long,
Mm-hmm.
and you're typing for years and years and years and for years and years and
Yeah.
years. And all you did is just sit. That can affect the SI joint.
Well, it could too, yeah, because so the tailbone is right below your sacrum. So if you have inflammation, say you irritated an area, that can cause problems in the SI area. Or sitting for a long time also will affect your lumbar spine. It could go hand in hand. So if you have, how do I say it, stiffness in your lumbar spine, because you sit a lot during the day, you have stiffness, you may then develop an SI joint problem because, like I was saying, if you have lots of movement somewhere, our bodies are smart. We're going to try to compensate. So it may be you have a little bit too much mobility here because you have so much stiffness from sitting in a chair all day. So that could be it. That could be.
Even though she's had 2 children, when she was in middle school,
Mhm.
no one pulled a chair out from under her.
Oh, so
And she
injury.
went right down on the bottom.
And that's a very common cause of SI problems if you fall on your bottom. Tailbone injuries, anything like that.
Grade.
Yeah, oh, absolutely. I mean, bone is bone, and especially in 7th grade because your ligaments, girls, anytime there's hormonal changes in our body, your ligaments are lax. So that's why they say girls can tear their ACLs and things when they're going through puberty because your ligaments are more lax at that point in your life. And so at 7th grade, if you were going through any hormonal changes, your ligaments are probably lax to begin with, then you had that fall. So you probably sustained maybe an SI injury at that point in your life. And then having the children, you did.
Well, I had C-section. I didn't have a.
But still, you know what happens is that SI joint has to expand to make room for the baby. So whether C-section or not, you have an SI sprain. Yeah. But you can't do anything about that one. It's going to happen.
I'm a legal assistant.
And then that doesn't help. Yes. Yeah. So that can contribute. Absolutely. That contributes to your pain. Yeah.
So I hope you found that information helpful. If any of these conditions and symptoms resonated with you, I want to guarantee you one thing. There is hope, and we assure you that we will find the appropriate solution to get you to live the unhindered life that you deserve. However, the most important part is to know exactly which one is the true cause to your sciatica. This is where we can help. Our job is to find the root cause of your pain. But if you're the type of person that puts things off due to a busy schedule or just is plain stubborn, then you may be causing more harm than good. Which leads us to the final most important thing I want to share with you. The number one biggest mistake people make that limits them from unlocking their true healing potential is that they ignore their pain and do nothing about it. If you choose to ignore your back pain, just know that the longer you wait to get help, the longer it's going to take to get it completely resolved. So just a little recap on what we talked about. Talked about the 3 common causes of back pain. We also talked about how to identify which one of these causes is the true culprit. And lastly, we talked about the biggest mistake people make with back pain. Now, there is not one clear, simple solution for everyone. Everyone is different, and everyone's condition may present differently. That is why it is so important to seek professional advice, so that you can know what program is best for you. If you're currently in back pain, and it is affecting the ability to live your life and do the daily activities needed to care for your family, then what I want you to do is click the button below to schedule an appointment with one of our back pain specialists so we can get you back to normal again.